Hi, welcome to our Pharma Topics channel. Welcome to the 37th series of Principles of Drug Discovery. In this, we are going to see about prodrugs. So, what is the need for prodrugs? First, we have to know why we need prodrugs. Almost all the drugs have some undesirable characteristics in their physicochemical and biological properties. So, these undesirable characteristics and therapeutic efficiency can be improved by suitable modification through biological, physical, or chemical means. The biological approach is to alter the route of administration. The physical approach is to modify the dosage form. The third approach is to enhance the drug selectivity while minimizing the toxicity. So the third approach leads to the design of prodrugs. The concept of prodrug is not new. Even in the 19th century itself, Adrian Albert was the first to introduce the concept of prodrugs and suggested that the technique can be used to temporarily alter and therefore optimize the physicochemical properties and thus the pharmacological and toxicological profiles of an agent. A prodrug is formed by chemical modification of a biologically active drug that will liberate the active compound in vivo by enzymatic or hydrolytic cleavage. According to International Union of Pure and Applied Chemistry, a prodrug is defined as any compound that undergoes biotransformation before exhibiting pharmacological effects. Prodrugs are considered to be inactive or at least less significantly active than the released drugs. Once inside the body, the prodrugs undergo enzymatic or chemical reaction to show drug-like properties. That is good absorption, good distribution, good metabolism, and get easily eliminated. The prodrugs provide possibilities to overcome various barriers to drug formulation and delivery, such as aqueous solubility, chemical instability, insufficient oral absorption, rapid pre-systemic metabolism, insufficient penetration into the brain, toxicity, local irritation, and patient compliance, such as odor and taste. So the prodrug design actually appears like this. So here you will have the drug molecule. It is having the difficulty to cross the barriers. So you attach a pro moiety such that it crosses the barrier along with the drug and the pro moiety. When an enzymatic cleavage cleaves this, the drug gets freed and it gets entering into the target tissues. This is the concept of prodrugs. So the design of prodrug structure is considered in the early stages of clinical development. This will include an appropriate functional group that is called pro moiety for derivatization. Pro moiety should be safe and rapidly excreted from the body. The choice of pro moiety should be appropriate for the disease state. Some of the common functional groups used in prodrug design are carboxylic, hydroxyl, amine, phosphates, and carbonyl groups. Let us see the functional groups and the derivatives used in the design and synthesis of prodrugs. So you can see from this table, for carboxyl groups, you can use esters, amides, and alpha acyloxy esters. For OH group, you can use esters, carbonate esters, and ethers, phosphate esters, and alpha acyloxy alkyl ethers. For amine groups, you can use amides, carbamates, imines, enamines, N-acyloxy alkoxyl carbonyl groups. Let us see the applications of prodrug design. So one is a pharmaceutical application. It can improve the taste. It improves the odor if needed. It can change the physical form for preparation of solid dosage forms. It can cause a reduction of GI irritation. It can be the design can be used for the reduction of local pain on the injection, and it can cause enhancement of drug solubility and dissolution rate, that is increasing the hydrophilicity of the drug. Then it can cause enhancement of chemical stability of the drug. Then there are pharmacokinetic applications. So one is enhancement of bioavailability, that is lipophilicity to cross the cell membrane barriers. Then it can cause prevention of pre-systemic metabolism. It can be used, a prodrug strategy can be used to prolong the duration of action. It can be, a prodrug strategy can be used to cause reduction of toxicity. And then you can use the prodrug design for a site-specific drug delivery or drug targeting. Let us see the requirements for an ideal prodrug. A potent, suitable prodrug should be lipophilic enough to cross a membrane or a metabolic barrier, but at the same time, it should be hydrophilic enough to fulfill solubility, bioavailability, and transport criteria. It should not have intrinsic pharmacological activity. It should rapidly transform chemically or enzymatically into the active form where desired. The metabolic fragments apart from the active drug should be non-toxic. Let us see the types of prodrugs. It is of majorly two types. One is carrier-linked prodrugs or bioprecursor or metabolic prodrugs. The carrier-linked prodrugs are of four types. One is a double prodrug, macromolecular prodrug, site-specific prodrug, and manual prodrug. There is another classification. It classifies as type 1 and type 2. In type 1, there are two subdivisions. 1A, where it is a targets the site target therapy, and 1B, it gets metabolized. Type 2A, it targets the GIT fluids. Type 2B, it a prodrug strategy designed for extracellular fluids. And type C for target tissue or cell. Carrier-linked prodrugs. The active drug is linked to an inert carrier group that is removed by enzymatic action to liberate the active drug. Usually the carrier group is inert, non-toxic, and pharmacologically inactive moiety that could aid in the delivery of an active drug. Example, pecampicillin is a carrier-linked prodrug which on hydrolysis liberates penicillin. So you can see from this. So here is the carrier, usually a fatty chain or a polyethylene glycol. It will be having a temporary linkage with the drug. When it enters into the body, it crosses the barriers. Their enzymatic or cleavage or chemical transformation separates the carrier and the drug, and this gets easily eliminated, and the drug will have the pharmacological action. Next is double prodrugs or pro-prodrugs. Example, cefpodoxime, proxetil. Next is macromolecule prodrug. Example, naproxen 2, glyceride. Then site-specific prodrug, sulfasalazine. It breaks into sulfapyridine and 5-aminosalicylic acid. And then mutual prodrug. It's a combination of 17-alpha-estradiol and nor-mustard. Next is bioprecursors or metabolic prodrugs. The inactive compound is converted to the active drug through metabolic transformation. There is no temporary linkage between the active drug and the carrier moiety. Example, sulindac is a bioprecursor that is converted to sulfide metabolite to an active form. Next is, you can see from this, prontosil. It is a bioprecursor. It gets a metabolic reduction to sulfanilamide, which acts as antibacterial, and 1,2,4-triaminobenzene. Next is cyclophosphamide. It is inactive. In the liver, by CYP enzymes, it gets converted to phosphoramide mustard, which is an anti-cancer drug. Apart from this, there are some classifications. Type 1 prodrugs, they get bioactivated inside the cells. We have seen type 1 and type 2. Example for type 1 is acyclovir, where it gets phosphorylated inside the cancerous cells. Or usually it is an antiviral drug. In the virus infected cells, this gets phosphorylated. Type 2 prodrugs, these are bioactivated outside the cells. Example, loratadine is a non-sedative antihistamine that is a prodrug of desloratadine. Let us see the classical examples from now on. Prodrugs to improve drug solubility. A prodrug may be designed to possess solubility advantages over the active drug, enabling the use of specifically desired dosage forms and routes of administration. For example, if the active drug is insufficiently soluble in water, to prepare a desired intravenous injection, a water-soluble prodrug such as hydrocortisone sodium succinate could be prepared through the addition of functional group that later would be detached by the metabolic process to yield once again the active drug molecule. A drug can be made hydrophilic by conjugating with hemisuccinate, hemithalate, metasulfobenzoate, etc., which forms water-soluble sodium salt or potassium salt. Steroidal moieties are poorly soluble in water. The solubility can be enhanced by converting the steroids into phosphate form that are inactivated in vivo by phosphatases. Example is prednisolone phosphate. So this is prednisolone and this is the phosphate group. Next example is chloramphenicol succinate. Next is phosphonetine, which is a very classical example to improve the drug solubility. It is a sodium salt. Is a form of a prodrug of phenetine, which is used as an anti-epileptic agent. This prodrug is used to reduce drug precipitation and consequent local irritation by phenetine at the injection site. The prodrug has an aqueous solubility more than 7,000 times greater than phenetine. The prodrug has a shorter half-life, approximately 15 minutes in blood, and is rapidly converted to phenetine in the blood. Next is the enzymatic action initially releases unstable intermediate, which is rapidly converted to phenetine. So you can see, so phosphonetine, this is a prodrug by phosphatases. It gets converted into phenetine by spontaneous chemical hydrolysis. Next, let us see some of the examples for prodrugs to improve biostability, that is improving the bioavailability. If an active drug is prematurely destroyed by biochemical or enzymatic process, the design of prodrug may protect the drug during its transport in the body. For example, val-acyclovir is a prodrug of acyclovir. Normally, the bioavailability of acyclovir is 10% to 20% only after oral administration. Val-acyclovir is converted to acyclovir by liver esterases via the first pass metabolism, resulting in 55% bioavailability. It is more than double increase in the bioavailability. In addition, the use of prodrug could result in site-specific action of greater potency. For example, dopamine in the treatment of Parkinson's disease is unable to cross the blood-brain barrier as a dopamine. So L-DOPA is the strategy. However, its prodrug levodopa is able to cross the blood-brain barrier and then it is converted into the dopamine in the CNS. Let us see some of the examples of prodrugs to improve drug stability. Some drugs attain very low bioavailability due to extensive first-pass metabolism in the liver on oral administration. To increase the oral effectiveness of it, the drugs have to be formulated resistant to the metabolism. Propranolol metabolized to inactive O-glucuronide and parahydroxy form, leading to approximately less than 40% bioavailability. Hemisuccinate conjugation leads to increase the bioavailability by 8 times. So this is the propranolol structure. Another one example is cepomandal naphtate ester. This is also having the same strategy. Next, let us see some of the prodrugs to improve patient acceptability, that is improving taste. Most of the preparations are having a bitter taste. The bitter taste of the drug leads to poor patient compliance. One example is clindamycin. It is one of the well-known examples where acetate ester is extremely bitter. But when it is formulated as a palmitate ester, the drug becomes less water-soluble and results in tasteless drug. So these are some of the examples. The parent drug is chloramphenicol. These are having the taste problems. The prodrug with improved taste is palmitate ester, clindamycin, palmitate ester, sulfasalazole, acetyl ester, and triamcinolone formulated as diacetyl acetate ester as a prodrug to improve the taste. Let us see some of the examples for prodrugs to improve patient acceptability by reducing the GI irritation. Most of the NSAIDs have GI irritation. So salicylic acid, when it is available as acetyl salicylic acid, it's a prodrug strategy. It gets by esterases, it gets hydrolyzed to salicylic acid. It acts as a NSAID. Diethylstilbestrol is a parent drug. Its prodrug is phosphestrol. Kanamycin palmovate is a prodrug. Phenylbutazone, a NSAID, which is having GI irritation. Less GI irritation is N-methyl piperazine salt of phenylbutazone. Nicotinic acid. A nicotinic acid hydrazide is having less GI irritation. Let us see some of the drugs, prodrugs to improve absorption. Drugs applied to the skin are absorbed very poorly. Corticosteroids are such examples which, when esterified or acetonized, show increase in the topical absorption. Once it is absorbed through the skin, an esterase acts to release the drug. Example, flunisolone acetonide. Epinephrine used in treatment of glaucoma is provided in the form of dipivefrin to achieve better corneal penetration. So here you can see, so this is epinephrine. When it is substituted with CH3 thrice CCO, then it becomes a dipivefrin. Let us see some of the examples for the prodrugs to improve drug absorption with some other examples. An example for that is prodrug enalapril, which after oral administration is hydrolyzed to enalaprilat, an active angiotensin converting enzyme inhibitor used in treatment of hypertension. Enalaprilat itself is poorly absorbed when taken orally, and thus the prodrug strategy enalapril may be administered then it gets converted to enalaprilat. But enalaprilat is also available as for IV administration also. It is having shorter half-life. Then the next examples are ampicillin for drug absorption improvement strategies, prodrugs. Ampicillin is a prodrug. Pivampicillin is a prodrug. Ester is pivalyl oxyl methyl. Then ampicillin is also available as a becampicillin. It is a carbonate ester prodrug. Carbenicillin, it is available as a indanyl carbenicillin. Indanyl ester, it is a indanyl ester. Then cefuroxime available as cefuroxime acetyl. It is a acetyl ethyl ester. Then enalaprilat, which we discussed. Enalapril is the prodrug. It is a ester of 1-carboxylic acid. Then terbutaline, it is a prodrug is ibuterol. It is a dibutyl ester. Let us see some of the prodrugs to improve the drug distribution. One example is sarmoxicillin, which is a prodrug, and the parent drug is amoxicillin. Sarmoxicillin is having increased distribution. Then amoxicillin, for ampicillin, the parent drug, the prodrugs are becampicillin, pivampicillin, and talampicillin, which has increased distribution. Then let us see some of the prodrugs to prevent drug metabolism. Parkinson's disease is known to be due to deficiency of dopamine. Because of its polar characteristic, dopamine can't cross the blood-brain barrier. Levodopa, an amino acid, is recognized by the amino acid carrier proteins. It is carried across the cell membrane. It is a prodrug of dopamine. When levodopa is inside the cell, the enzyme decarboxylase removes the acid group to produce dopamine. It is a prodrug strategy which prevents the drug metabolism. So here you can see, so this is a levodopa by dopa decarboxylase. It converts it to dopamine in the brain. But when it is peripherally converted, it causes a lot of problems related to dopamine, like hypertension and so on, GI irritation and so on. Let us see some of the prodrugs to improve site-specific drug delivery. Most drugs administered orally or intravenously go through the bloodstream to the site where they are required. During this process of transport, they can cause other toxic effects. Anti-cancer chemotherapeutic drugs are cytotoxic because they also affect the normal growing cells. A site-specific prodrug can alleviate the toxicity to normal cells. So here you can see, this is a cancerous cell. So this is a prodrug strategy which is inactive. It is clubbed with an active drug, and the prodrug is conjugated with the enzyme antibody. It enters into the cell. Then there it gets activated. the prodrug gets removed and it exerts the site-specific drug delivery. Example is diethylstilbestrol diphosphate is a prodrug designed for breast cancer. This prodrug can be activated through an enzyme in the breast tissue as shown here. Diethylstilbestrol diphosphate by phosphatase, it gets converted into diethylstilbestrol in the cancerous cell and alleviates breast cancer. Next is dipivefrin, for example, is a prodrug of epinephrine formed by the esterification of epinephrine and pivalic acid. This enhances the lipophilic character of the drug, and as a consequence, its penetration into the anterior chamber of the eye is 17 times that of epinephrine. Within the eye, dipivefrin hydrochloride is converted by enzymatic hydrolysis to epinephrine. So this is dipivefrin. Then in the eye, it gets hydrolyzed to epinephrine. The next example is sulfasalazine for site-specific drug delivery. Sulfasalazine is an example of prodrug of 5-aminosalicylic acid linked via an azo bond to sulfapyridine. The sulfapyridine moiety makes too large and hydrophilic to be absorbed in the upper GIT, and this permits transport into the intact colonic region where the bacterial enzymes reduce the azo bond and release the active drug 5-aminosalicylic acid for local action in the colonic diseases such as inflammatory bowel disease. Let us see some of the examples of ocular prodrug site-specific drug delivery systems. One is acyclovir. So acyclovir is the prodrug moiety is 2O-glycyl ester. It has increased solubility which is more than 30 times than the parent drug. Pilocarpine is available as acid diester. It's a prodrug. It has increased aqueous solubility and increased efficacy. Terbutaline, it is available as diisobutyl ester. It is 100 times more potent than terbutaline for reduction of intraocular pressure. Timolol, it is available as aliphatic and aromatic amine or alkyl carbamate ester. It has increased corneal penetration and efficacy to treat glaucoma. 5-fluorouracil, 1-alkoxycarbonyl, 3-acyl and 1-acyloxymethyl prodrug moieties are useful. They have a significant improvement in the corneal penetration, resulting in reduction in the dose and toxicity of 5-fluorouracil. Let us see some of the prodrugs to improve sustained action, to have a longer duration of action. A drug may be made more water or lipid soluble as desired to facilitate absorption via the intended route of administration. For example, for patients requiring prolonged antipsychotic therapy, the addition of decanovate ester to haloperidol molecule makes the molecule less water soluble. Subsequently, when it is administered by a deep muscular injection, intramuscular injection, the molecule provides a sustained effect that lasts for up to 4 weeks. Other examples are estradiol cypionate, testosterone propionate, flufenazine decanovate, naloxone disulfate ester. So, in a nutshell, we'll see the therapeutic area and the prodrug. Proton pump inhibitors. They are esomeprazole, lansoprazole, pantoprazole, rabiprazole are all prodrugs. Antiplatelet drugs. Clopidogrel is a prodrug. Antiviral drug. Valacyclovir is a prodrug. In case of hypercholesterolemia, anti-hyperlipidemic drugs. Fenofibrate is a prodrug. Psychostimulant lisdexamfetamine is a prodrug. For influenza, oseltamivir is a prodrug. Hypertension, olmesartan is a prodrug. Immunosuppressant, mycophenolate mofetil is a prodrug. And in case of glaucoma, latanoprost is a prodrug. So it's a very short, useful information of prodrugs. I hope it will be useful for you. Thank you for listening. Happy learning. Kindly share this to more of your friends. Kindly subscribe to our Pharma Topics channel. Kindly press the like button if you like this video. Go through all the series of videos available in the playlist Principles of Drug Discovery in the Pharma Topics channel. Study well and score well in your forthcoming exams. Thank you.